Hello, Dr. Alicia here, and this video is about the Dutch test, and this is specifically the Cycle Mapping Plus. So this is one of my favorite tests that I do on women to find out what's going on with your hormones. So let's go ahead and I'm going to walk you through how to collect and how to prepare for this test. This test looks at what's going on with your hormones, and one of the reasons why I love it so much is because our hormones as women change throughout the month. So estrogen goes up at the beginning and comes back down, and then progesterone goes up and then comes back down. So with this test, we're able to gather what's going on with those hormones throughout the month. If we were to just test on one day, we would just know, oh, well, that's what progesterone was doing on that day, and that's what estrogen was doing on that day. But with this test, we're able to get a really clear picture of what's going on with your hormones throughout the month. So I love this test. And then this test, the plus part, that means that it includes our regular Dutch Plus. And I have a whole nother video on that entire test and how to fill out the requisition forms. At the end of this, I will just go over quickly what that looks like in completing that part of the test, because it is different when you would take it versus if you were just doing the Dutch Plus, okay? So since you're here, I know that you're doing the Cycle Mapping Plus. So what comes in your kit? You are going to have a requisition form here, and if it's not marked for you already, you're just going to mark Dutch Cycle Mapping Plus, put in your demographic information. You are going to also include the day of your last menstrual cycle. So here's what I want you to understand about your menstrual cycle. Your menstrual cycle begins on the day of your bleed. Red blood, no pink, no brown. Okay, no spotting. It's the day that you bleed red blood, and it continues until you bleed red blood again. Okay, so some women and even myself thought, okay, well, my cycle is 5 days long or 7 days long or 9 days or 3 days long. That's my menstrual cycle. No, your cycle, that's phase of your cycle where you bleed. Okay. And what I love about this test is we're looking at all phases of your cycle. So when you ovulate, and then that luteal phase, that second half of the cycle where progesterone starts to come up, and it's that feel good hormone. And many of you may be doing this test because you don't feel good, right? So I need you to have that understanding because you're going to test during both cycles. Okay. There's going to be different things that happen there. So let's go ahead and go over this here, okay? So what you're going to do is the day of your first bleed, red blood, that's day 1, okay? Inside of your booklet, you're going to see these different options for cycles. So there is an option for a normal or short cycle that's considered less than 37 or 34 days. If you are 35 days or longer or 34 days or longer, then that's a long cycle. And then they have a no cycle section. So I like to use this for women that, you may not have a cycle anymore and you don't know why. So we can see what's going on with your hormones over an extended period of time. You may not have a cycle anymore because you've had a partial hysterectomy. So you no longer have a uterus, but you do have ovaries, and those are producing hormones throughout the month. So we want to be able to see what those look like. Or your cycle could just be completely irregular or have some variations in it. So you're going to pick which one applies to you, okay? So either your cycle is less than 34 days, and you're going to do the normal or short. Greater than 34 days, you're going to do the long cycle. Or if you don't have a cycle at all, then you're going to use this schedule. If you don't have a cycle at all, you can go ahead and begin tomorrow testing, okay? And what you're going to do, and this is for everyone, is you're going to have a packet of these strips. There's 25 in here. If you see that you're getting low and your cycle hasn't come yet, you can just call the lab directly. Their contact information is right on the booklet, right on the back of the booklet inside. And you can just call them directly and tell them you need more strips, okay, if you have a really long cycle. So sometimes I work with women, they got cycles that are 50 days long, 60 days long, and we just keep collecting so we can find out what's happening during that time. So when you go to collect, no matter which cycle you're using, short, long, or no cycle, you are going to urinate on this strip, okay? And you want to just go ahead and go from this top line down, okay? You want to saturate it. You can just urinate directly on it, or you can go in a cup and then you just dip it in there. Once you're done with that, you're going to want to put your name on here, the date that you collected, the day of the cycle, okay? So remember, we're starting all the way back at day 1. It counts as the day, okay? And then you could be collecting on day 8, day 22, any of those. You want to put what day it is and the time of the collection. And then these right here, you can just, you don't necessarily have to put the time if it's waking or anything like that. Most of them, they should be waking. So you can circle waking, and you want to do this with your first urine collection of the day, okay? We want the most concentrated urine. So let's say that you wake up and you're like, I gotta go to the bathroom and it's 5 a.m., but I don't normally get up until 7. Go ahead and use this strip, and you want to use it on your first one. Let's say that you forgot. Just collect it that next time that you use the bathroom, okay? And you can even make a little note on there that that's what happened that day. There is a schedule inside of the booklet, okay? So if you are not cycling at all, you're just going to begin tomorrow, okay? You're going to start collecting right away, and you're just going to collect on day 1, day 3, day 5, 7, 9, 11, and they'll have a whole schedule here for how you're going to collect. If you are cycling, you are going to begin on day 7. So day 1 is the day that you bleed red blood. And then when you get to day 7, your period may be over, it might not be over, but you're going to start collecting in the morning, okay? So you're going to pee on this strip. After you pee on the strip, you're just going to go ahead and close it up like this, and it will sit, and you're going to let it dry for about 24 hours. If you're questioning, I don't know if it's dry yet, let it dry a little longer, okay? And then once it's dry, you just close it up, make sure you labeled it, and then you can just put them in like a Ziploc bag or put it back into this bag. You can organize it however you'd like. You're going to follow this schedule. So back to women that are cycling. What schedule are you following? You're going to either pick the normal or short if you're less than 34 days. And if you're more than 34 days, you're going to do the long, okay? And if you're sometimes like, well, sometimes I'm this, sometimes I'm that, just pick the one that you do most often, okay? You can always keep collecting. And they don't vary that drastically, okay? But you're going to follow the schedule. So day 7 is the first day of collection for everyone that still has a cycle. And then you're going to, if you have a long cycle, it's not going to be again until day 11 and then day 15, and then it starts picking up more, okay? Your short cycle people or normal, you're going to collect on day 7, day 9, day 11, 12, 13, 14, 15, 16. So it starts to pick up for a bit where you're collecting every day, and then you'll start going back to every other day, okay? Now, let's say you get off schedule. You're like, oh, I forgot to collect today completely. Just collect the next day, even if it says here you're supposed to collect on day 24 and then day 26, and then you end up collecting on day 25. Perfectly fine. Just write it on there, and then you're going to write it on here in the booklet as well, too, okay? The lab will sort it all out. It's perfectly fine. I don't want you to stress about those different types of things here, okay? So you're just going to be collecting every morning your first urine sample, okay? Now, when it comes to what's in the rest of your kits, once you have a cycle again, this is for the cycling women, once you bleed red blood again, you're going to count day 1, day 2, day 3, day 4, and you're going to begin the last part of this test, okay? And you're going to stop collecting too. The morning samples, the ones where you're collecting every morning, once you bleed, you're done collecting those, okay? And then you're going to wait. Day 1, day 2, day 3, day 4, you are going to then have 4 urine samples that you collect throughout the day. And then you are going to have 5 saliva samples that you collect throughout the day as well. Okay. If you are not cycling at all, once you get to day 31 of collecting, you are just going to that next day collect these. Okay. So let's say you're like day 4 came and you forgot for cycling women, just collect it on day 5. Okay. Or day 3, however that falls, okay? The main reason why it's pushed out a little bit is because they don't want you to bleed on the strips, okay? So you're going to go ahead and skip to once you've collected all of your morning samples throughout the month and your next cycle has started, or if you're non-cycling, you're done collecting your morning samples, you're going to jump on over to page 15 in the booklet here. I believe sometimes they'll say They'll tell you to skip to a page in this book that Dutch provides, but it's not the right page number. So you are going to go ahead and jump on over to this page here, and it's got some instructions here for you, okay? So before you collect these samples on the day, so you're collecting 4 urine samples, 5 saliva samples, no avocados, no bananas, no fava beans within 48 hours of collecting. And then there are some supplements to consider that you'll want to let us know if you're taking those, okay? So tyrosine, L-dopa, and then DLPA, which is D-L-phenylalanine, and then mucuna, and then quercetin, okay? You'll want to let us know because those could skew your results. The other thing that's very important as well is if you are taking any DHEA or pregnenolone hormones, let us know about that. We can give you specific instructions around that, as well as if you're doing any kind of steroids. So even if you're doing like a nasal spray for allergies or any kind of corticosteroids, let us know that because there may be a period of time where we may need to pause that or we may just need that information. But we'll work with you to know what that is, okay? So when you're inside of your book, you're going to see the last 4 samples that you're doing, okay? And all of the instructions, what I just went over as far as what not to eat and everything, they're right here in the booklet. One important thing too about this day is make sure that it's on a day that's like your normal typical day, okay? So no excess drinking, excess eating, no strenuous exercise, no like surgery, like things like that. We just want a typical day because we are getting saliva samples and urine samples that are looking at your cortisol patterns there. And if stress is just a normal part of your day, that's typical for you. So we want to see what that reading looks like for you, okay? So inside your booklet, you're going to see how to collect these last 4 here, okay? So you are going to have, and they're color coordinated for you as well too, okay? So when it comes to these samples here, what you want to do is you have a morning sample of saliva and urine that you're going to do right when you wake up. So you are going to do a urine sample. Urine samples are still the same, but now they're color coordinated, okay? You're going to do a urine sample, and then you're going to do a saliva sample. With this saliva sample, you're going to pop open the blue lid, and then you're going to take out this thing that's kind of like cotton, and you're going to put it in your mouth. You're just going to chew on it, get it nice and saturated. Don't do it longer than 5 minutes though, okay? But you want this nice and wet. And then you're going to put it back in here, and you're going to close it, and you're going to pop these in the freezer until it's time to ship them off, okay? So put those in the freezer. If you're at work, put them on ice or something like that. So you're going to collect first thing in the morning, and then 30 minutes later, it's good to set a timer, you're going to do one more saliva sample. And then another 30 minutes later, you are going to do another saliva sample. And then about an hour or so later, you're going to do a urine sample. So one thing to know about those first 3 saliva samples that you did, so right when you woke up, 30 minutes later, and then another 30 minutes later, you're not going to brush your teeth, okay? So you're going to have to wait to brush your teeth, no flossing, anything like that. You can rinse your mouth 10 minutes before you collect, but no brushing your teeth or anything like that. And then all the other ones that you do throughout the day too, you won't want to eat. You want to eat at least an hour before, okay? You don't want to get any contamination of food or anything like that into your sample. You will want to rinse your mouth though about 10 minutes before each sample. So we are to, now with your samples, you have done a urine and a saliva first thing in the morning, and they're color coordinated for you, okay? So just put your name on there, the date and the time. You've done a urine and saliva first thing in the morning. 30 minutes later, you did a saliva. Another 30 minutes later, you did a saliva. Now, about an hour or 2 later, so 2 to 3 hours after you woke up, you are going to do a urine sample, and then you only have 2 more collections the rest of the day, okay? You are going to do between 4 and 5 p.m. You're going to do a urine and a saliva, and then between 10 p.m. and midnight, you are going to do your last sample, okay, before bed. Okay, if you wake up in the middle of the night, do this sample here, which is just an extra sample. You can do that in the middle of the night, and that lets us know what's going on with your hormones and your cortisol throughout the night as well. So it's considered a insomnia sample. And even if you're not up all night, but let's say you wake up, we can get that information there. Okay. So those are the main things as far as just that last collection that you'll do, and you'll write that information so it's perfect. It's all color coordinated for you, super simple. You've got your waking, 30 minutes later, an hour later, and they match what's right here on this form here for you, okay? So you'll include all of that in there. So you'll simply rip this page out with those last 4 samples that you did, and then whether you did the no cycle, long cycle, normal cycle, you'll rip that page out. You will take all of your urine samples, and then the 4 that you did as well, you can pop them back into a bag, and your saliva samples along with that original requisition form that we talked about at the beginning of the video. I just talked about the front of this, but there is also a back side that you'll want to complete. So this back side talks about disease status, if there's things that you suspect you may have or you've already been diagnosed with. It talks about your fatigue levels, and then it talks about different symptoms that you're experiencing. So with the symptoms that you're experiencing, they put them into different categories like androgen, excess, or deficiency. So there's an area where it says loss of scalp hair, increased body hair or facial hair, and acne. And it gives you a box to check them, and then you rate it from 0 to 3 here that you can see here. But you may say, okay, well, I don't have acne, but I am losing some hair, or I have some facial hair, but I don't really have body hair. Just circle which one you have, and then you can write the rating right next to them if you don't have them all or the ratings differ. This is completely manual, so this is something we look at. It won't be typed in anywhere. So you can just make it clear here. I wish they separated them all, but they kind of just have them all listed together. And then there's some additional symptoms. There's some questions about weight, your hopes, and then any medications or supplements that you're taking. So you want to make sure that this is complete. You'll pop everything right back into your box, and you'll have your 2 strips or your 2 forms that you pulled out from here, all your samples, everything. You can put them back into the box, and then there's a return label for you. So you're just gonna pop this in the mail, send it back via United States, or UPS is who that's through, and just make sure that you freeze your saliva samples up until you ship them, okay? One important thing is don't leave it in a mailbox or anything like that. You want to drop it off at a UPS to make sure that it gets shipped right away, okay? And it's not sitting out in the heat or anything like that. So that is it. This is one of my favorite tests. It gives you so much good information about exactly what's going on with your hormones throughout the month. Very, very good. I know a couple tips are that with these right here, when I collect, because I test myself all the time for different things, I put these right in my bathroom next to the toilet, like on the floor. Each day, every night before I go to bed, I like pull out one. So as soon as I walk into the bathroom, there's like a scale in there. I put it right on there. I see it, so I don't forget to do it. If I put it behind the toilet, sometimes I'll forget. But if it's right there, like on the floor where I'm like forced to see it when I'm waking up in the morning and walking into the bathroom, then I see it and I remember to just go ahead and collect. And remember, if there's a day that you missed, just write it on there. Just be clear about the day and time that you collected everything, putting that information on there, just so we have an accurate understanding of how you collected. And that's it. So this is the Dutch test, the Cycle Mapping Plus. It's one of my favorite tests. I've run hundreds of these because it provides so much valuable information. So if you have any questions, then just reach out to your coach, and we are here to support you along the way. Again, if you need any additional strips, if you have a very long cycle, then you can contact Dutch directly and they will ship you some more, or you can reach out to us as well and we'll get that ordered for you. I hope that this was helpful.